Okay, hi everyone. Thank you for joining us today and welcome to MPT Program Preview Day. We're really glad that you can join us today. My name is Jessica. I work with the rehab schools here in the Faculty of Health Sciences, and I'm here to guide you through today's session. Some of you are joining us online, and for those of you attending today in person, today is a great opportunity to explore the program and connect with our faculty, staff, and our current students. And before we move into the information session, we would like to begin with a land acknowledgement. So Western University is situated on the traditional lands of the Anishinaabeg, the Haudenosaunee, the Lenape, and the Chonodon nations, on lands connected with the London Township and Sombre Treaties of 1796 and Dish with One Spoon Covenant Wampum. At Western, we acknowledge the ongoing injustices faced by Indigenous peoples in Canada and accept our responsibility as a public institution to help correct miseducation and foster respectful relationships through teaching, research, and community engagement. The MPT program you are here to explore today is actively taking steps to carry out this vision, including supporting pathways to increase Indigenous enrollment and foster more equitable opportunities within our program. Through these efforts, we aim to build a learning community where reconciliation moves from intention to meaningful action. So now I will pass things on to Dr. Erin Miller and Heather Gillis, who will start with a quick introduction to everyone who is joining us today.
Thank you so much, Jessica. So my name is Erin Miller, and I'm the Master of Physical Therapy Program Chair. We're so happy to have you here today with us, both online and for those of you in person, so we can share with you about our program and answer any questions that you may have. So I'm just going to pass the microphone down the line so that each person that's here today can give a quick introduction of who they are and what their role is.
Great, thank you very much. My name is Heather Gillis, and I'm the Associate Director of Educational Programs in the School of Physical Therapy. I'm a teaching-focused full-time faculty member, and I typically teach in the area of musculoskeletal practice. And I'm going to pass it down the line here.
Great. Hi, everyone. My name is Dave Walton. I'm the current admissions chair for our program, so I'll come up and talk to you about some of that process. And then I'm also a researcher and one of the educators in our program as well.
Hi, everyone. My name is Samantha Dorelp. I'm the academic coordinator of clinical education. And so that role involves leading the clinical education portion of the program and organizing all of the clinical placements.
Morning, everyone. My name is Can Bulat Özkurt, and I'm the International Recruitment Coordinator for the Faculty of Health Sciences, and I help international students with their admissions into our programs.
Hi, everyone. I'm Kyra. I'm the Graduate Affairs Assistant for Physical Therapy. I send out communications to the students about things like course evaluations, self-enrollment, program awards, and things like that.
Great. I'd also like to just take an opportunity to acknowledge that we do have student representatives with us here in the room today. So I'd like to acknowledge the time that they're taking out of their academic programming in order to support our day here. So we have Thomas Roach, as well as Tyler O'Neill, and we have Dr. Christina Ziebart, who is actually a full-time faculty member here in the School of Physical Therapy, but she is an alumni member from the combined program. So she's here to be able to speak to the combined program for anybody who might have interest in that area today. So I want to just take a moment to be able to reflect on the definition of physical therapy that's been provided by the Canadian Physiotherapy Association. So the profession of physical therapy is a patient-centered profession. We really do work within this profession to really understand the whole patient and not just the condition and not just the disease. So through our time with the patient, we come to understand what it is that the patient isn't currently able to do. So what activities are meaningful and important to them that they're not able to do or participate in. And this might relate to sport, to work, or to recreation and leisure. And then we conduct a thorough clinical examination. And in some instances, we're required to identify a differential diagnosis. And then through that, we identify all of those important things for that patient that they're not currently able to do. Our clinical examination allows us to be able to identify what are the impairments and are there any other issues that may impact the individual's ability to fully participate or engage in care. from this, understanding the impairments that currently limit that individual, we match that to those meaningful and important participation and activity limitations that they have, and identify a highly tailored and individualized intervention plan for them. We work collaboratively in interprofessional teams, but we are fully independent and autonomous healthcare practitioners. Because of this, then we work across all major body systems. So we work in musculoskeletal or orthopedics, looking at conditions that would affect joints, bones, muscles. We also work in the area of cardiovascular pulmonary, so the lungs, the heart, and the vascular system, as well as in neurological rehabilitation, so working with both the peripheral and central nervous system. We are a broad and diverse healthcare profession, and because of that, we work with all individuals across the lifespan, from children to individuals of later life stage. We work in areas of manual therapy, orthopedics, oncology, amputations, burns, acute care, cardiovascular conditions, neurological conditions, primarily traumatic brain injury, spinal cord, as well as other neurodegenerative conditions. And because of this, that enables us to work in a vast variety of healthcare settings. So we work in general hospital settings, school settings, rehabilitation settings, acute care, advanced practice, primary healthcare teams, and that's just to name a few. So as students that would be enrolled in the physical therapy program, you should anticipate that you will be building competencies and expertise across all of these areas. We have 27 full-time faculty members in the School of Physical Therapy who are focused to be able to deliver the core curriculum of this program. We have highly respected, internationally renowned researchers, as well as we have a well-balanced faculty complement to be able to provide teaching-focused activities related to all of the areas of core competency. We also are supported by a really strong community network of part-time faculty members that come in and help support our student body in their particular areas of expertise. And I'm going to pass it over now to Dr. Erin Miller.
So now I have the opportunity just to talk to you a little bit about our space here and about our program and our program structure. So for those of you that are joining in person, right now you're in the Ronald G. Schmigel Building for Entrepreneurship and Innovation. And this is our teaching and learning space that we've been in this is now our second year in this space. We do run classes and programming in other spaces on campus. So sometimes our students are over at, for example, Elborn College, which is another building on campus. But this is really our primary teaching and learning space. So right now, those of you that are here in person are in our main classroom. And so this accommodates our class of 120 in each of our years. And so this is where we would have lectures. We sometimes have discussions in here, workshops, that kind of thing. And then those of you that will join us for our tour, and those of you online can see in the picture that's on the bottom right of your slide, those are our clinical skills labs. So we have 3 labs that are quite similar. Those accommodate 40 students at a time. So a third of our class is in each of those clinical skills labs. And that's where we learn to practice our hands-on skills. We do some of our case discussions in those lab rooms. So you can see we've got nice plinths. Those are wireless plinths that are run on batteries. And nice space to be able to practice. And then we have a host of equipment that we bring into those skills lab to learn the different parts of practice. So this is our space. We're really excited about it. Lots of windows for those of you who are here so you can look out onto campus. Keeps it nice and alive in here. So great space, happy to have it. In terms of our program, so this is an accredited entry to clinical practice program. So it does prepare you to sit the national exam for physiotherapy. And some of you may or may not be aware that we do have some licensure changes going on in the country right now. So things are changing a bit with our licensure, but this program will prepare you to sit the new licensure exam that's coming and the current licensure exam that is currently in place. It is a 2-year full-time program, so we don't have a part-time option. So that's an important thing to be aware of. And it is a rigorous program of study. So it is a busy 2 years, and probably our current students, when they come up for the panel, can speak to what a typical day looks like and what it's like to be a student here. But it is a busy 2-year full-time program. We have our program set up based on settings. So some programs, for example, will look at body systems. So some of the other physical therapy programs you might be looking at may have like a musculoskeletal unit, a neurological unit, a cardiorespiratory unit. Our program is set up according to settings of practice. And so it's those different settings that you go out to. So we have clinics, we have acute care, we have neuro rehab. And so that's how our program is structured. And so you have different courses that speak to those settings. And then later on in the program, you get integrated and kind of to the full spectrum of care. But that's how our program is structured. So a little bit different in terms of the setup. We are an in-person program, although we do have some synchronous online and synchronous asynchronous sessions. So there'll be a lot of in-person programming, but then some sessions where you'll be like over Zoom and it will be like a live online session. And then there'll be some sessions that will be on your own time asynchronously. So for example, like a pre-recorded module type thing that's already set up and you do on your own time. So it is a mix, and we do offer blended learning. The other thing to note is there's individual and team-based activities. So one of the things that's a bit unique about our program is that every term of our program, you're in a learning team. So you're always paired with a group of other students. That's kind of your support system. That's your student network for that term, and it switches every term. In each term, you will have individual things that you'll be responsible for, like exams, case discussions that you prepare for individually, but then you will also have team-based activities. So you might have like a team-based presentation that you need to prepare for. So each term is a mix of both of those activities. Just to give you an idea of how it's laid out, in year 1, you start with a foundations term. So that's an opportunity to have everyone get sort of on the same page in terms of the foundation that's then going to underpin the rest of your learning here. So we have a foundational skills component and a foundational knowledge component, as well as anatomy and an interprofessional education course, are 2 actually interprofessional education courses that really give you the foundations for physical therapy practice. In term 2, which starts in the winter of first year, you go into your first settings term. So that's when you start to branch out into your acute care course, your rehab course, and your first clinics course. Into term 3, you continue with your settings, and then you get to go on your first clinical experience or clinical placement coming towards the end of our first year. And that's a really exciting time for students, because that's really like the first time that they're taking what they've learned here in class and getting to go out into the world of physical therapy practice. Then you get a little bit of a summer break, not too long, but a couple weeks. And then you come back to us for term 4, which is the start of your second year. That's when you start to get into your advanced courses for clinical settings. So you get into sort of your advanced acute care, your more advanced clinics, and your more advanced rehab practice. You then go on your second clinical experience. So our second year students right now are out on their second clinical experience until the holiday break. You come back after the holiday break in year 2 to do your complexities and integration. So that's when you really start to think about things across the whole lifespan and starting to really integrate everything from those different settings of practice. So that's where it's really starting to all come together for you. You go out on 2 further clinical placements back to back. So you have your 3rd and your 4th clinical placement experience, and then you come back and rejoin us for a consolidation term before you're done the program. And consolidation is just a really good opportunity to sort of finish off the program, fill in those final missing pieces, reflect on everything you've learned over the 2 years, and make sure you're ready to transition out into autonomous practice. So that is the way that our program is structured and the layout of the program. So I am now going to pass it over to our admissions chair, Dr. Dave Walton, so he can talk to you about our admissions process, which is often one thing that students are really wondering about when they come to these sessions.
All right, great. Thanks, Erin. So I'll talk to you a little bit about the process that you'll have to follow to get into the program. You can see the breakdown of the seats that we have available. So we have now an intake every year of 120. We ballpark somewhere in the range of 1,100 to 1,300 applicants a year. So you get a general sense of the the competitiveness of the program. We have a couple of designated streams you can see there. So we've got 5 seats for a designated Indigenous student pathway. We've got 5 seats for our combined MPT PhD program, and these are students that are doing actually a 5-year program where they will complete that with both the PhD and the MPT degree. And then we've currently got up to 20 seats now for international applicants. As you can see, the math, it looks like the math doesn't line up. That's because we don't always fill all of those, but we always take 120 students every year. You can see here the requirements, the application requirements for our students. So domestic applicants, you would apply through ORPAS, which is the online application portal. International applicants have an option. They can apply either through ORPAS or through a direct stream, and we actually encourage people to go through the direct stream if they can. We do require a 4-year undergraduate degree for entry. There are a number of prerequisite courses. Those are all listed on the website. So anatomy and social sciences and arts and that kind of thing. And so what we require is demonstration of an overall 70% in each of those courses, each of the prereqs. And then I'm just going to skip down to the bottom there just because it's relevant here. Those prereqs may or may not be included in the calculation of your sub-GPA. And that depends on when you completed those courses. So the sub-GPA is calculated based on your last 20 half credits. So for most people who are carrying a full load, that's kind of the second half maybe of your second year, your full third year, and the first half of your fourth. And so again, your prereqs may or may not be counted in that depending on when you took them, but we do need to see the 70% on those. And then we've got 2 reference letters. So we need 1 academic. So someone who knows you from an academic setting institution can talk about your performance in the classroom and your learning potential. And then 1 professional. And what we're looking for now is somebody who can talk more towards how you might function as a healthcare professional. We have loosened the requirements of that a little bit this year. It used to be that had to be a physical therapist as a professional reference. We recognize that not everybody has access to that, but we do need somebody who is part of a regulated health profession. And again, there's a list of those on the website. And if you have specific questions, we can talk about those later today. A couple of other requirements that we need. So we have an applicant statement component. This is your opportunity to sort of tell us a little bit about you. And there are 2 prompts on there. So you'll need to give us a little bit of your own written work. We need you to have demonstrated some exposure to the physical therapy field. That can be either volunteer work, so it could be unpaid, or it could be paid work. And we need to see the number of hours. We're going to ask for a name of a supervisor, that sort of thing. And then we also want to see other experiences, whether those be paid or unpaid, that don't have to be directly relevant to physical therapy. So what we're really looking for here, you can get a sense, is kind of reasonably well-rounded students. So, there was a time many years ago where we would have just basically ranked everyone by GPA and kind of took the top ones. What we're looking for now is we've kind of changed that weighting a little bit, where obviously, GPA is a good performance of academic potential, but we also want to see applicants who can show that they've also done other things out in the community, okay, and that they've been involved in some healthcare and things like that. And then the last thing you'll see there that we still require is the Casper score. And so that's the sort of evaluation of ethics and critical thinking and bias and things like that, and that you do online. So there's our numbers you can see right now. So this was for the most recent intake year. So you can see we had 1,214 applicants. We made 212 first-round offers to domestic students and 18 international. And that's pretty common because, of course, not everybody accepts our program. And we ended up with 121 is what we ended up taking in. And you can see the cutoff GPA there is 3.77. And people always ask me how that converts to numbers. And I want to say 85-ish. Can someone confirm that? And so you can see there as well now the process that we follow. As I said, we're no longer simply ranking everyone by GPA. So we first we do rank by sub-GPA and by Casper score. So we're trying to get a sense of academic performance in the past, as well as ethical, critical thinking skills. And so we rank according to both of those. And then we take the top 500 of those, and those end up going out to external referees. So it's not just us who make these decisions about admissions. These go out to external referees who are themselves mostly practicing physical therapists. And each of them will pass back to us a ranking. So they will get a subset of that 500. They'll review it. We've got a scoring rubric that comes back to us. And then ultimately what you can see is we're looking for the average score from each of these 3 external referees. And we already know we've got people ranked by sub-GPA and Casper score. And at the end of the day, that's how we make the decisions about the first round offers. We do often tend to go into the wait list. So I'll just say that out loud. Keep that in mind. If you don't happen to be one of the ones in the first round, we will sometimes have to go into the wait list in order to fill the class.
So this is just meant to give you an idea of potential costs. Certainly, it's important to see costs change over time. So this is just a snapshot of what you might expect. So it's always important to check on the website what current tuition fees are. But just to give you a rough idea of things that you might be thinking about in terms of cost, is that gives the approximate per term cost for the 6 terms. So you would pay that sort of $3,700 to like $4,000 for your tuition per term over the 2 years, and there's 6 terms included in that. So we'll be paying that 6 times, just to give you a rough idea of costs. Again, go back to the Western website because they're updating their tuition fees. So those are posted. And then in terms of books and other learning resources, so there is some equipment that you need to buy to participate in the program. So textbooks are a cost. We require things like stethoscopes are a cost to students that they buy for themselves. Goniometers, which is this tool that we use to measure how much joints are moving, is a cost. And so there are just some extra costs to think about for you. And so we've put that kind of around the $1,000 to $1,500 for the entire program that you might expect to spend. The other thing to keep in mind is clinical placement costs. So you are responsible for living costs. And Dr. Duralp is going to speak a little bit more about clinical education, but it is important to note that students are required to do placements out of London during their time here. And so sometimes students are paying a double living cost. And so they might be on clinical placement for 7 or 8 weeks outside of London. Sometimes they're able to live with like family members, friends, that kind of thing. But there are times where you may need to keep your place in London, and then you also may be paying for additional living costs outside of London while you're doing clinical placements. So just to expect that that is something that is part of the program and an expectation. We don't, unfortunately, pay for your housing costs when you're doing clinical placements outside of London. And then certainly to be aware of, we do have some subsidies and bursaries available. So different organizations at Western, and certainly our program also offers some bursaries and that kind of thing. So we do try our best to keep you aware of opportunities for money when opportunities for money exist, and encourage you to apply for those opportunities. But there will still be out-of-pocket costs for these types of things. And now I'm going to pass it over to Samantha Durrell, who's going to talk about your clinical placements.
Wonderful. Thank you, Dr. Miller. So I'm excited to talk about clinical placements, and sometimes students are always wondering, what does it look like when they're not here in this beautiful building learning about everything that is about physiotherapy? And so with clinical placements in this program, you have 4 different opportunities when you're out in the community. And each of those clinical placements is embedded within a clinical experience course. So there's a course that's designed to support you and prepare you for when you go out on that clinical placement. So across the 4 placements, each placement is either 7 or 8 weeks, and that totals 30 weeks of clinical experience. So you can imagine what that looks like across the 2 years of the program. It's 1,125 hours of exposure. And as you've heard, when it comes to physiotherapy, we're working with individuals across the lifespan with a wide range of conditions. And so to ensure that you're prepared for that, you get exposure across settings, areas of practice, and the lifespan. And all of that is supervised by a physiotherapist. And so you can see with the arrow here what it looks like across the 4 placements. We have that junior placement. And as Dr. Miller said, that's at the end of that first year. So you can appreciate that you've spent a full year in the academic portion of the program. And then just when you're ready to share that knowledge, out you go into the community and you do your first clinical placement, which is really exciting. And so that's the junior placement. And then in the second year, you have 3 opportunities to be out working in the community. So the intermediate placement is running basically right now when the students are out, November to December. Then we have the senior clinical placement, and then we have that final consolidation placement that's towards the end of the program. And so at the end of that consolidation placement, you will be almost ready for entry-level practice. And so that sounds like a lot. And so again, it's intentionally designed so that all of these placements scale up caseload management, independence, so that you're prepared. So there's lots of opportunity working with a physiotherapist to build up those skills, those competencies, so that you're prepared when you're finished the program. Another question that kind of comes up is where do you complete your clinical placements? So each physiotherapy program has a catchment area. And so you can see Western's catchment area in purple here. And so basically it runs to the east, kind of to the Kitchener-Waterloo area, up north to Owen Sound, to the south end past St. Thomas, and then all the way out to Windsor in the west. So we have a big catchment area. And what that means is we have lots of opportunity. And so students are completing 2 placements typically within London. And so out of the 4, 2 of them you will probably be in London, but then 2 of those you are expected to be outside of London. So again, we have lots of hospitals and rehab sites and clinics situated throughout our catchment area. And so there's lots of wonderful opportunities outside of London. So the majority of students typically complete their placements within our catchment area. That said, though, some students might be interested in completing a placement back home or going somewhere outside of our catchment area. So there are opportunities for students to complete placements out of catchment. And so examples of that might include students going to the McMaster catchment area, somewhere close to Toronto, for example, or something further east towards the Queen's catchment area. So again, those exist, opportunities kind of outside of our area, but also out of province. So we do have students that apply for placements out in BC, in Alberta, and then even on the East Coast. Okay, it's not necessary, but there are some students that come in and hope to complete placements in other areas. So that's an opportunity. The other thing that's really interesting is that we have students interested in completing placements abroad. So we have groups of students that complete international placements. Sometimes they do those together. So we have a group of students going to Australia. This year we have students that are going to Malta. We've sent students to the UK. Students have been to Dubai, Hong Kong. And so we have wonderful relationships with international partners, so existing sites that we can send students to. But then we also have students that are curious about different countries where we don't necessarily have connections yet, and we've built those connections. So again, there's lots of opportunity to explore if there's something specific that you're interested in. So going back to those 30 weeks, so those 1,125 hours, again, the purpose of all of these hours is to build up your experience, but again, ensure that you get exposure across different experiences. And then there's that element of depth of exposure. So you get a lot of time when you're out there working in the community. So students must complete a placement within each of these key settings. So students complete an acute care placement. So within a hospital setting, they complete a placement within a rehab setting. So that might be an outpatient clinic. It might be an inpatient department within the hospital. And then they complete a placement within ambulatory care. So that's your outpatient, private, or public clinic. And then students get exposure across areas of practice that you've heard of already, and then also exposure across the lifespan. So again, working with children, working with adults, and then also working with seniors. And again, lots of exposure so that at the end you feel comfortable when you're ready for practice. And then I just wanted to leave you with this to give you a sense of all of the opportunities that are available within the Western clinical placements. There are diverse experiences. So again, within London and outside of London, students get opportunities to work within different clinical placement models. So working with your peers in 2-to-1 models, working with 4 students within a student-led initiative. So lots of different opportunities. We also are very lucky. We have a tremendous community of experienced clinicians that are very passionate about taking students and welcoming students into their interprofessional healthcare teams. So lots of experience working with different physiotherapists, but also working within and with other disciplines. Again, thinking about occupational therapy, social work, etc. And we have a supportive and welcoming clinical community where they have particular onboarding processes to ensure that you're prepared when you start your placement on day one. So they have onboarding processes, they have site leads to support you as well. We have world-renowned clinical sites. So these are just examples within London. The London Health Sciences Centre, Parkwood Institute, Fowler Kennedy Sports Medicine Clinic. Some of you might know some of these names. But again, these are wonderful experiences just outside of our doors here, where they welcome so many of our students every year. In addition to that, we have exposure to specialized practice. So if students are interested, they can work within developmental pediatrics. They can get exposure to pelvic health, sport. Other examples like oncology, hand and upper limb clinics are available, and even within rheumatology. So lots of different opportunity. So if you are interested in these areas of practice, for example, these are things that you can bring forward. So we meet with students individually at the start of the program or close to the start of the program to talk about your interests, what you might be interested in getting experience with, what you might be curious about but not sure, so that we can take that into consideration when organizing clinical placements. And then we have unique and innovative opportunities. We have student-led initiatives. As an example, we have 2 students right now that have just launched a women's health initiative where they're providing services to women that would otherwise not have access to care. And they did that on their own, obviously supervised by other physiotherapists, but they literally developed and launched a clinic, which is incredible. We have virtual international placements where students get to partner and collaborate with students internationally while completing a placement locally. So they get opportunities to be exposed to global ways of approaching care, which is an incredible opportunity. We have research-aligned placements and clinical scientist placements for students that are interested or curious about research and how it aligns with clinical practice. Another great example is we've just launched a specific placement that's focused on working with elite athletes. So we have a student, for example, that's working alongside the OHL. So just to give you a sense and highlight all of the different opportunities, and really that it looks different for every student that's in the program. So again, that placement trajectory for you will be different than someone else. But again, there's lots of opportunity.